Hi, my name is Geraldine Reid and I'm a hospital pharmacist. You may meet your hospital pharmacist when you are in hospital after your cardiac event, maybe as part of your cardiac rehabilitation program. There's often a pharmacist involved in that to do the presentation about the medications. So managing your medications is just as important for your heart health as following a healthy food diet and doing your exercise. So there's many different medicines that are used in heart disease. There are medicines that are used to prevent heart disease, such as statins, which will be used to lower your cholesterol. And then there are other medicines that are used to treat heart disease or to treat the symptoms. An example of that would be a diuretic, a water tablet, which would be used to reduce fluid retention. So if you have heart disease, you may need multiple medications. And this can be very confusing at the start, but there is lots of help out there to help you to get to grips with your new medication. You can talk to your GP, you can talk to your community pharmacist, and then you've got your cardiac rehabilitation nursing service in the hospital to support you as well. So it's very important for you to know about your medications. So you must feel comfortable to ask questions about your medicines and keep asking questions. And if people don't answer them in a way that you understand, you keep asking until you understand and have the knowledge that you need to know why you're taking your medicine. Different medicines generally do different jobs, but sometimes they do the same job. So, for example, antiplatelets like aspirin, ticagrelor, those drugs prevent blood clots in your blood vessels. Anticoagulants do the same job, but they do it in a different way, so you may be on both of these drugs. So you might be wondering why you're on both. Sometimes the same drug is used for different things. So, for example, a beta blocker might be used for controlling your blood pressure. It might be used for angina or irregular heartbeats, and is often used after a heart attack. And this is one of the reasons that it's very important not to share your medication with other people. It might seem like you're on the same medication, but the reason that you're taking it may be different. So what do you need to know about your medications? You need to know the name and the strength of your medicine. So for example, aspirin would be the name, 75 milligrams is the strength. You need to know how and when to take it, if you're taking it in the morning or if you take it in the evening or more than once a day. You need to know why you're taking it, and you need to know why you're taking it in your own words. So is it to thin your blood? Is it to control your blood pressure? And you also need to know, most importantly, where to get more information. So as I've mentioned already, you've got your general practitioner, your doctor at home, your community pharmacist, your hospital pharmacist also at the cardiac rehabilitation talks, and also the cardiac rehabilitation staff in the hospital. The Irish Heart Foundation produced a very good booklet called Step by Step Through Heart Medicines, and this will contain most of the information that you need, so that it's handy to have that at home so you can look it up at a later date. So how are you going to manage your medications? And the answer is to be organised. So you need to carry an up-to-date list of medicines, your current list of medication that you're taking, and your community pharmacist can help you to do this. You need to check all your tablets with your pharmacist when you pick up your prescription. Go through everything. This is a really good way of becoming very familiar with your medication, and if you forget what something is for, that's an ideal opportunity for you to ask the pharmacist just to remind you. If your prescriptions change, as they sometimes do when people are increasing or decreasing doses or changing medications around for whatever reason, then you should bring your old medication back to the pharmacy so that they can get rid of it for you, and so that you don't have it around your house and confusing you at a later date. You should try and keep a couple of weeks ahead in terms of the supply of your medicines so that you won't be caught out or stuck not being able to go and pick it up when you need to. And you need to make sure you keep a close eye on the expiry dates. Plan ahead for travel and bring your up-to-date list of medications with you. That can be on paper or on your phone. Carry your medicines in your hand luggage and in their original containers. Don't transfer them into alternative containers. So now you have your medicine from your community pharmacy, how are you going to remember to take it? Well, we all forget to take our medicines at some times. It's very easy to do. It can also be very tempting to skip a dose or to take a lower dose if you think that you're feeling better or if you think that you don't need this particular medicine anymore. Failing to take your medicine properly can have a negative impact on your treatment. The drug won't work as well, and you could have a negative impact on your health. Here are some strategies that you can use to try and help you to remember to take your medicines. You can get a weekly pill box that you can buy in your community pharmacy. You can ask your pharmacist to blister pack your medicines. and then that makes it very easy to remember when to take, what to take. Set reminders for yourself using your notes or a calendar, or you can use your phone. Develop a routine for taking your medicines and try to take it at the same time every day. A good way to do this is to associate it with an activity that you do every day, like, for example, after you brush your teeth. Put your medicines where you can see them or in a place that will remind you to take them. So, continuing that example, you could keep your tablets beside your toothpaste, so that that would all be connected up together. Don't put your medicines away in a cupboard. It would be easier to forget to take them if you don't see them. And if you do forget to take a medicine, then you should take it as soon as you remember, but not if you don't remember until the next day. So don't double up. If you find that this is becoming a problem for you, if you are forgetting medication regularly, then it may well be worth asking the pharmacist in the community to blister pack them for you. Make an action plan. It can also help build a medication taking habit. So what you're trying to do is to take it at the same time every day. And if you get used to doing that, and you form a plan in your mind, or you can write it down, a plan about how you're going to take your medication, then it will become automatic when you start getting used to it, like taking it after your breakfast or taking it after you've done your teeth or whatever. So get to know your community pharmacist. They have lots of information on all your medications and can offer very practical advice on how to get the most out of your medicines. Pharmacists are able to advise on side effects and also on any drug interactions, and they can also be very helpful if you're not able to contact the prescriber. So you should continue to take your medicine even if you're feeling better or you feel like you don't need it anymore, or if you have no symptoms. Don't stop the medication suddenly. Remember, heart medicines are usually for long-term treatment. Tablets can cause additional or side effects. They're usually infrequent, they're usually short-lived, and the prescriber can usually sort them out for you. The most common side effects are tummy upset, constipation, and headaches. The doctor will prescribe the drug that is most suitable for you. But if you suspect you might be experiencing a side effect, then you should report this to the GP. They can't read your mind. You need to tell them that you think you're having a side effect and what you think is causing it. The doctor might be able to adjust your medication accordingly, then changing it from maybe a twice-a-day dose to a single daily dose, or they might be able to change the frequency. Alternatively, if this medication still doesn't suit you, there are always alternatives. Again, it's important to remember not to skip anything and not to make any adjustments yourself. Always discuss it with the prescriber first. Many factors can affect the way your medications work. Medicines can interact with other medications, even over-the-counter medicines that you might buy in your community pharmacy. They can also interact with food and drink at times, and also with herbal remedies. It's always important to present your current up-to-date list of medications to your community pharmacist if you're looking to add anything new into the regime, and they will be able to advise you on that. Consider using one pharmacy where possible, because then they will have your up-to-date list of medications and they will know you and they'll know the medications that suit you and what you've had before, so they will be able to advise you better. It's so important to be honest with your healthcare professional, whether it's the doctor or the cardiac rehab nurse or your community pharmacy, if you're finding it hard to stick to the plan. It's not a question of looking whose fault it is that that's happening or that you're doing something wrong. You just have to find out what the reason is. You could have concerns about a drug, whether it's working or not working. You could be worried about a side effect that maybe somebody else has mentioned to you. You need to discuss this with your prescriber, and they will always be happy to help you. Most people don't like taking medicines. The amount of times that you hear this, I don't like to take anything for this. So if you feel like that, then that is completely normal. However, heart disease is very serious, and you need to take your medication as prescribed. And if you're having problems with that, you need to discuss it with a healthcare professional. Everybody on your healthcare team wants you to get the best benefit out of your medication with the least side effects. Remember, the heart medication is prescribed for you, so you know best how it's affecting you. You need to be familiar with it and let your doctor or pharmacist know how you're getting on. Don't be afraid to bother healthcare professionals, because that is what they're there for, and they want to help you to get the best out of your medication. So lastly, if you're having trouble sticking to your regime, just to remind you about the tips: develop a medication schedule that will become routine for you. Create reminders in whatever way suits you, in paper, post-it notes around the house, on your phone. Use your alarms on your phone if that helps, and ask your family and friends to remind you, because that can be very helpful in helping you to keep taking your medication. treatment for your heart disease involves a balance of lifestyle changes, diet, exercise, and medication. The medications will only work if you take them exactly as directed. You will benefit most by participating in all components of the cardiac rehabilitation and taking your medication as prescribed.